You're watching The Source on CNN Philippines. The national government continues its inspection of Metro Manila cities in preparation for a nationwide COVID-19 vaccination program. In the latest visit of the Coordinated Operations to Defeat Epidemic, or CODE team, they went to Marikina City, and local government officials there announced the opening of a mega vaccination facility. Let's go straight to the source of the story. We have Marikina Mayor Marcy Teodoro. Mayor Teodoro, welcome to The Source. Thank you for your time, sir.
Good morning, Pinky, and to all those watching us this morning.
So CODE team was there yesterday, and I do remember Secretary Vince saying that he was quite impressed with your plans over there in Marikina. Meron po kayong mega vaccination center, yung po yung Marikina Sports Complex, and from what I know, you can vaccinate 10,000 individuals a day. Mayor, tell us more about this.
Yes, correct, Pinky. It's a sports complex. It's a 2-hectare property that could accommodate 10 vaccination stations. And with the 10 vaccination stations, we have 12 vaccinators per station that could vaccinate 80 to 100 individuals per day. And with that, it could accommodate around 10,000, actually to 12,000. But we're being a little bit
conservative.
We're considering other factors, so
Yeah.
we're just pegging it at 10,000.
Opo.
What's important there, Pinky, is that we were able to simplify the process. It's a 3-step process that one person can get vaccinated within 30-minute period of time.
So,
Unlike other areas, I think we'll spend more than that period. I think that's basically what we have there. And more importantly, we have an infirmary or a treatment area there. We have set up a clinic there that could accommodate 30 persons if there would be adverse reaction to the vaccine. And the facility, the mega facility, is located in a 100-meter radius within the nearest hospital. There are 2 hospitals there in the area, a private and a public hospital, a tertiary hospital for that matter. And our cold storage facility, chain facility, is also located within the 100-meter radius. So the transport and of the vaccine will not be a problem.
That's what I found very interesting about this setup also in Marikina, Mayor. Kasi nga, yung mega vaccination facility nyo nandun din katabi or nandun mismo yung infirmary or yung monitoring facility na tinatawag nyo after vaccinate, imo-monitor. Nandun din yung malapit na ospital at nandun din yung malapit na cold storage facility. In other words, everything that works for this vaccination to actually proceed is within and around the mega facility.
May transport service din tayo that could pick up and drop off people that will be vaccinated. We have ambulance units in the area. Ano siya, naka-preposition na. Pati medical team. In fact, Pinky, I think Sec Vince Dizon told me yesterday that what is different also with Marikina is that we have put up an indemnification fund,
right,
as a financial and medical assistance fund for those who will be receiving the vaccine that will experience adverse reaction. Hindi natin ina-expect o inaasahan, Pinky, na maraming magkakaproblema o magkakaroon ng adverse reaction. Pero we're doing this in order to build up the confidence and trust of our people to the process vaccination program natin. Kasi mahihirap yan ang tinatanong. Paano kung
magkasakit ako?
Opo. Anong nangyayari sa akin? So we're taking care of that. We're putting emphasis or importance on the last step of the process, which is the observation or the care monitoring. We will not allow people to go home immediately, but we will monitor them for a period of time. And yung data management din namin, Pinky, may mga doktor kami niya-assign doon sa mga pinakunahan on a cluster basis or group or sector basis na magmo-monitor within 24-hour period after the vaccination, and in a month's time until the next the vaccination schedule. We are now pre-qualifying them, assessing, evaluating, profiling those who will receive the vaccine when we start the program. Kaya pagdating nila ron, kumbaga assess and evaluated na sila. Yung eligibility nila to receive the vaccine is already established. So yung first step namin, registration and validation na lang, if he is the same person having, we will be assigning a reference number to the person. So for easy monitoring and for easy identification.
Opo.
Kaya mabilis lang yung process.
But how does that actually work? Kasi I know your 3 steps would be screening, vaccination, and observation stage. So to your constituents, Mayor, who are watching us right now, what is the first step prior to the screening? Kasi for other LGUs, hindi ho ba merong app na ginagamit o kaya nagpapalista na sila kung sinong willing na mag-vaccinate? Sa inyo po, how does the first steps happen?
Exemplify ko, Pinky. For example, ngayon, ang first priority natin, yung mga healthcare workers natin, frontliners natin. Nag-consultation kami with the healthcare industry in Marikina. The public healthcare system, our private hospitals, clinics, doctors, group of doctors. So we've talked to them. Then binigay namin sa kanila yung intake forms, and they're doing now counseling among themselves. Institutional ang approach, Pinky. Isang hospital, mag-uusap-usap sila, medical and non-medical. Then ipo-profile nila. May inassign kami mga profiler, saka may inassign kami mga we created a task force for the vaccination program, a group of experts, mga nasa public health, infectious disease, immunologists, virologists, oncologists. Meron kaming ganon, mga Marikina-based doctors who are experts in their fields. So they're doing the consultation, the counseling, and the profiling. We start. It's a whole of community approach, Pinky, what we're doing. It's not unilateral on the part of the LGU na ginagawa namin lahat. Kaya tulong-tulong lang eh. Also, likewise, yung mga nasa private sector, mga private companies, corporations namin dito, mga industrial, also on the retail, nagko-conduct na sila ng among themselves, within their group, ng mga consultation and counseling. Kinukuha rin namin yung feedback nila about the program. I think aptly described, they have this what we call cautious optimism. Gusto nila magpapakuna, nakikita na yung pag-asa sa bakuna, pero gusto nila maging maingat doon sa pagpapakuna. Tinatanong kung ano yung klase ng bakunang gagamitin. Kasi mahalaga rin yung may paliwanag natin kung ano yung klase ng bakuna. Siyempre, depende ito, contingent doon sa availability ng bakuna. No? We respect the right of our people. Kung ano yung preference, ano yung choice nila. No? May option dapat. Ano? Kaya we would like to provide them with a diversified portfolio of vaccine.
I see.
Yung decision namin, kumakausap kami ng iba-ibang vaccine supplier. Pero siyempre, we will be heavily dependent on the national government's vaccine availability. Kasi yung bibili na yung vaccine, Pinky, in-emphasize ko nga kahapon kay Secretary Vincent, is for augmentation purposes only. Yung malaking pondo namin, yung malaking bahagi, maliit lang ang pondo namin, Pinky, pero yung malaking bahagi gagamitin namin sa process ng vaccination.
I see.
Sa mga preparation, logistical, administrative, and care monitoring.
Okay, so the bulk of the vaccines really will be coming from the national government. You're saving some of that money for the actual process, Mayor. That's how I understand it. So to clarify, do your constituents, do they have the right to choose the vaccine? And what if turn na po nila magpa-vaccinate at wala po yung vaccine? How does that actually work?
Pinky, let me rephrase, ang sinasabi mo sa akin, paano kung gusto na magpabakuna, wala pa yung bakuna? Am I correct, Tama?
That's right, Mayor.
Uh, sa ngayon, we're doing the counseling, we're doing the profiling, consultation, and we're hoping that the national government can deliver on their promise of the vaccine will be available the soonest time possible. Hopefully this month or early next month. Kaya kami naman, lahat ng preparation ginagawa na natin. Next week we will be simulating the the transportation of the vaccine from the port of entry to our cold storage. Pati yun, para yung proper handling ng vaccine ma-ensure din namin, pati yung how to prepare. Prepared na kami logistically, even the syringe that we will be using. Kasi hindi naman ordinaryong syringe din yung gagamitin. We need an auto-disabled syringe in order to mag-auto-lock yun pag na-meet yung tamang dosage para doon sa vaccine.
Yes.
Pati yung support drugs, mga epinephrine, mga kung sakali may bronchial spasm. This is what we're telling our constituency, and we're showing them and we're walking them through the process, and we're showing them logistically this is what we have. So we are really prepared at this point in time. Ang kulang na lang yung bakuna. Yun din ang sabi nga sa akin ni Sec Vince, mukhang ready na kayo, Mayor, at wala na kaming masabi pa.
Okay.
Bakuna na lang ang kulang. Kaya sabi ko nga kasi talagang we're waiting the vaccines from the national
Pero
government.
meron ho bang survey or alam niyo ho ba kung ilang percent ng inyong constituents ang number one, yung willing po magpa-vaccinate?
Ang gusto magpa-vaccine. Wala kaming pinagkaiba doon sa ibang city tulad ngayon, I'm doing rounds. I'm in a health center in one of our barangays now. I'm doing doing some consultation. Tinitingnan ko itong mga health centers namin. Pag nagra-random survey ako, tulad kanina, before the interview, may tinanong ako, 2 nanay na dala-dala nagpapa-check up dito sa health center namin. Sabi ko, gusto mo magpabakuna? Oo, Mayor, sabi niya, gusto namin magpabakuna. Pero baka pwede, may mauna sa amin, susunod na lang kami. Yung ganun may very cautious sila very cautious. Parang gusto muna nila siguro, sizable number, makita nila na magpabakuna.
Yung
at
iba.
kung maayos naman, makita nila safe at effective, then saka sila magpapabakuna.
Okay.
Kaya I've been consultant also with our city officials, particularly my vice mayor and some of the councilors, if we could undertake yung maging pioneering kami, mauna na kaming magpapakuna those who are eligible para makita naman ng mga tao na may mga nauna dahil nagtitiwala at safe. But we're letting the experts do the consultation and the counseling. Dahil tingin ko, this is the time that we should listen to our experts.
Right. Very quickly, Mayor, meron ho ba silang preferred na vaccine?
Pinky, please,
meron ho ba silang preferred na vaccine?
Yes, yes, definitely. May iba-iba yung preference nila depende doon sa information na tatanggap nila Kaya nga nakita namin ang important aspect nitong vaccination program is the proper information and consultation that will be undertaken by our task force of experts. Iba-iba dahil kung ano yung mga depende, sasabi nila mas effective o mas safe yung inactivated virus compared to the genetically produced. Meron naman sinasabi mas effective yung ganun. Pero we're letting our experts do the explanation.
Alright. Marikina Mayor
this is their time. This is their period na mapakinggan sila.
Marikina Mayor Marcy Teodoro, sir, good luck and maraming salamat po sa inyong oras.
Salamat sa pagkakataon. Thank you very much.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.